afternoon, all of you. We will shortly start our session. Very good afternoon, all of you. I am Dr. Shrikant Hadole, Assistant Professor and Organizing Secretary of this event from Jupiter Ayurved Medical College, Nagpur. I welcome you all the respected dignitaries, respected guest speakers, dear participants, faculty members, and colleagues. I welcome you on behalf of Jupiter Ayurved Medical College to the national webinar on Bal Rog, endorsed by MUHS Nashik and MCIM Mumbai. Before proceeding towards our webinar, I would like to request all of you to please join for the Dhanvantari Stavan.
नमामि धन्वन्तरीरादिदेवं सुरासुरवन्दितपादपद्मं लोके जरारुक् भयमृत्युनाशं दातारमीशं विविधौषधीनां शङ्खं चक्रं जलौकान् दधतमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुद्यांशुकपरिविलसन् मौलिमं भोजनेत्रं कालाम्भोदोज्ज्वलाङ्गं कटितटविलसच्चारु पीताम्बराढ्यं वन्दे धन्वन्तरिं तं निखिलगदवन् प्रौढदावाग्निलीलं प्रौढदावाग्निलीलं प्रौढदावाग्निलीलम्.
I wish Lord Dhanvantari may bless us all with the health, wealth, and prosperity. Today, the national webinar on Bal Rog, it is the fifth and the last session to be organized under the national webinar series by Jupiter Ayurved Medical College and Tarini Ayurved Hospital, Nagpur. So this webinar is endorsed by MUHS Nashik and MCIM Mumbai. We are very much thankful to respected Dr. Ashutosh Gupta sir and respected Dr. Shrikant Deshmukh sir for endorsing this event. We have among us respected Dr. Mahendra Agarwal sir as a MUHS observer. I welcome you, sir. So before proceeding towards the session, I would like to request our respected Principal Dr. Subhash Wage sir to address the gathering. Over to you, respected Principal sir.
Thank you very much, Shrikant sir. Am I audible?
Yes, sir.
Very good afternoon to one and all. I welcome all the participants, dignitaries, and guest speakers. Today's guest speakers in the program on behalf of entire Jupiter College and Hospital. This is the last webinar we are conducting in the series. and how far we are is conducting whole exercise is all the listeners have to decide. As this, the aim of the apex body is to bring the efficient and competent doctors, those who will serve the society, and in accordance with that series of practical oriented webinars, those will inspire and motivate the budding surgeons, physicians, and those who will effectively and in turn effectively serve the society. So first, in our first exercise, we are conducted with the webinar on surgery. In that, Dr. Sahave had delivered on the aspect of laser surgery in hemorrhoids. And in other session, Dr. Pramod Dhage had lamented on the role of laparoscopy. In our second webinar on Shalakya Tantra, the Dr. Sir, they lamented on the various aspects of psychosurgery. In the third webinar, Dr. Mandar Ranade had highlighted upon the endoscopic role of endoscopy in the gynecological procedures, and the Dr. Pratisha Rathod highlighted on the non-surgical management, non-hormonal management of the gynecological disorders. So I hope, and as per the feedback we received from the audience, they conveyed us that they have greatly benefited from the whole exercise, and they are motivated a lot, and they want to pursue the further skill-oriented training in their subject. So I think the aim has already met. And after that, we had conducted upon the webinar on Nidan also, wherein the practically we are shown how to examine the patients with videos and how the various signs they look like. Now in the last series, we are conducting on the Balroga. Herein also our stress is on the practical management of the practical and successful management of the disorders with the Ayurveda treatment. And hopefully this webinar will also inspire and motivate many of the pediatricians, budding pediatricians, and I wish all the best for them. And I thank the registrar and the VC of Maharashtra University of Health Sciences for endorsing a webinar. I thank you, Dr. Agrawal sir, who is our elder brother, who is acting as a MUHS observer here. And I also thank Dr. Gupta sir for endorsing this seminar on behalf of Maharashtra Council of Indian Medicine. With this, I wish all the best for all the participants. With this, I hand over the desk for further proceedings to Dr. Shrikant sir.
Thank you very much, sir. Now, I would like to request Vice Principal and Associate Professor of Department of Balroga, respected Dr. Sundar Singh Danga sir, for further proceeding. Over to you, Sundar sir.
Thank you, Dr. Shrikant sir. Thank you, Principal Vagesh sir. Good afternoon, all. Am I audible?
Yes, sir. Yes.
Okay. I am extremely honored to get this opportunity to introduce our eminent guest speaker on this occasion of National Webinar of Kamar Bharatya, which is conducted by our institution, Jupiter Ayurvedic Medical College, Nagpur. So welcome all the participants, eminent experts who are talking today. We have had the formal permission, as Dr. Vagesh had said already, for this webinar from Maharashtra University of Health Sciences, Nasik, as well as the Maharashtra Council of Indian Medicine, Mumbai. So especially thanks to all of them, and especially thanks to our esteemed expert today who are going to talk on particular subject. I will tell you. So I welcome Dr. Mahendra Agrawal sir, Professor Panchakarma Bhavsai Ayurvedic College and observer of today's program. I welcome Dr. Ashutosh Gupta sir, President MCI Mumbai, Dr. Shrikant Deshmukh sir, Dean Faculty of Ayurveda MHS. I also welcome our Secretary Ma'am, Mrs. Tarini Vikhare. And today we have eminent speaker, Dr. T.Y. Swami sir and Dr. Roshni Aniruddha Ma'am, who are the expert in the Kamar Bharatya. All respected participants in this seminar, teaching faculty of our college. So Dr. T.Y. Swami sir will be going to deliver the lecture on role of Ayurveda in the management of neuromuscular disorder with the case presentation. And for this session, we have moderator Dr. Nitin Wagmare sir. So welcome, Dr. Wagmare sir. Sir is from Basumatibai Shahid College, Hadapsar, Pune. And I thank you, Dr. Pooja Raut and Dr. Pooja Rathod, who will be the co-host for the Dr. Swami sir's lectures. Next session will be given by the Dr. Roshni Anirudhan ma'am. Her topic is role of Ayurveda in the management of childhood epileptic disorder, with case presentation, and moderator for this session will be Dr. Archana Bhad ma'am, HOD Balrod, Government Ayurvedic College, Nagpur. So welcome ma'am. And I would like to now introduce Dr. T.Y. Swami sir. Dr. T.Y. Swami sir has done their post-graduation from Banaras Hindu University, Varanasi, PhD from Banaras Hindu University, Varanasi, and sir is approved PhD guided by Maharashtra University of Health Sciences, Nasik. Sir has done 3 research projects at the Government Ayurvedic College, Usmanabad. Currently, sir is working as a professor and head of Department of Balrog at the Government Ayurvedic College, Usmanabad. Sir, having teaching experience more than 27 years, sir has guided more than 28 PG students, and near about 5 to 6 PhD students. Sir has published more than 40 research articles in the national as well as the international journals. Sir has chaired more than 14 sessions at national level, and sir has also guided and given the talk on various ROTP which are conducted by Central Council of Research in Ayurvedic Sciences. And sir is administrative board study member in Babasaheb Ambedkar Maharashtra University, Aurangabad. Sir is a subject expert of Maharashtra University of Health Sciences and examiner as well as the paper setter of various universities, including Maharashtra Institute of Health Sciences. Dr. Swami has been awarded from the Department of Ayush, Maharashtra government in 2018 for the Maha Ayush Puraskar. So welcome, Dr. Swami sir. Before that, I would like to request Dr. Agrawal sir, today's observer. डॉक्टर अग्रवाल सर, मैं आपसे विनती करूंगा कि हमारे जो 5 वेबिनार हमने कंडक्ट किए हैं उसके बारे में आपके 2 शब्द, और उसके बाद हम लोग तुरंत अपना स्टार्ट करेंगे सेशन. डॉक्टर अग्रवाल सर.
थैंक यू डंगा सर. ज्युपिटर आयुर्वेद मेडिकल कॉलेज द्वारा आज बालरोग विषयावर नॅशनल वेबिनार आयोजित केलेला आहे. आज आतापर्यंत ज्युपिटर आयुर्वेद महाविद्यालयाने 5 विषयावर नॅशनल वेबिनार आयोजित केलेले होते. त्याच्यामध्ये शल्यतंत्र, शालाक्यतंत्र, प्रसूती तंत्र, रोग निदान आणि आजचं बालरोग. या 5ही वेबिनार त्यांनी खूप व्यवस्थित, याच्यापैकी जे 4 वेबिनार झाले ते खूप व्यवस्थित पार पाडले. आणि त्यांची जी थीम होती, म्हणजे वेबिनार घेताना जे थीम होती की प्रॅक्टिकल अप्रोच, म्हणजे विद्यार्थ्यांना आणि डॉक्टर्सला त्याचा कसा फायदा होईल हे त्यांनी खूप चांगल्या रीतीने ऑनलाईन प्रोसेसने समजून सांगितलं आहे. त्याबद्दल मी विद्यापीठातर्फे त्यांचं हार्दिक अभिनंदन करतो. आजच्या कार्यक्रमाला उपस्थित महाविद्यालयाचे प्राचार्य डॉक्टर सुभाष वाघेकर, उपप्राचार्य सुंदरसिंग डंगा सर, ऑर्गनायझिंग सेक्रेटरी डॉक्टर सर, तसेच गेस्ट स्पीकर टी.वाय. स्वामी सर, डॉक्टर रोशनी मॅडम, मी आणि मॉडरेटर, या सेशनचे जे मॉडरेटर आहेत त्यांचं हार्दिक अभिनंदन करतो. आणि त्यांनी पुढे असेच वेबिनार फिजिकली पण कंडक्ट करावे असं मी त्यांना सूचना देतो. धन्यवाद सर.
धन्यवाद डॉक्टर अग्रवाल सर. और हमी जो 5 वेबिनार लिए उसका अहवाल आपको तुरंत ही शीघ्र ही आपको अग्रेषित करेंगे. और आप 5 वेबिनार में आए, हमारे कार्यक्रम में उपस्थित रहे, आपका अमूल्य समय निकाल के हमें मार्गदर्शन किया, शुभेच्छा दिया, उसके लिए आपके बहुत बहुत हम आभार व्यक्त करते हैं ज्युपिटर आयुर्वेद मेडिकल कॉलेज की ओर से. धन्यवाद डॉक्टर अग्रवाल सर. और नाउ आई वुड लाइक टू रिक्वेस्ट डॉक्टर टी.वाय. स्वामी सर to start their session. Dr. Swami sir.
Good evening, everybody. Are you able to hear me?
Yes, sir. Yes.
Hello.
Yes, sir.
Are you able to hear me?
Yes, sir. From my side, you are audible.
Yes, sir. Please go
Yeah.
ahead.
Yes, yes.
Okay. Thank you. Thank you. At the outset, really I want to thank
Yes, sir, you are audible.
Subhash.
Yes, sir, you are audible. Very good afternoon, sir.
Very
It's
good
very
afternoon,
nice
Subhash
to
Wage.
hear you after a so long gap.
Yes, sir. I am very thankful. Generally, I not, participate this webinar because of my preoccupied schedules. Today also, unexpectedly, I had to come to an administrative work, which was instructed by our ICE director. I had in out of station, but anyhow, I don't want to miss this opportunity to interact with our youngsters. I'm working in this department since many years. Initially, we are very few people who are really dedicated for the ball dog department. I am very happy that a good number of the people are working very seriously, and young people are really working very focusedly. Now, I feel it is a good opportunity to interact with them. My favorite, almost many of our Ayurvedic people, whether they are interested or not, the cases neuromotor disorders generally come to our OPD, and we treat it within various options and various procedures. And majority of them, most of the times, get treated, otherwise they get improved, and we get in a sometimes due, sometimes undue, what you call reputation we get out of them. And for this, as we're working for last many years, we wanted to create a document for these things, these neuromotor disorders, which are never attempted by the modern medicine people to get treated. Initially, we had a lot of problems. What sort of assessment criteria we should adopt to claim that this regime, whatever we are adopting, whatever the treatment we are giving, really working? Because in many patients, we get improved our milestones, we get improved our motor functions, we get improved our cognitive functions, but we're unable to exclude that natural phenomena of their development. So by trial and error methods, we did adopted many procedures like JFMC, cognitive score. Then we developed an independent way of assessing the criteria, that is development quotient. When I first used this word, many of the people were surprised how really it works. But later on, it had come into the literature. Developmental quotient, we made it like that. In a particular age, what was the developmental quotient? And after treatment of the particular age, what could be the developmental quotient? It is a almost very near to certainty to assess our treatment efficacy. Anyhow, this neuromotor disorders, especially the cases like cerebral palsy and this encephalitis and this post-encephalitis and other genetic disorders, which are very commonly comes to us within various neuromotor disorders, which may include metabolic disorders, genetic disorders. I don't want to go into that detail of the etiological factors. So we had a set of modality of treating this one. Dr. Pooja, have you there online? Pooja Raut? Hello? Because one of my Pooja Raut?
Yes, sir.
Hello? You are online?
Hello.
Okay.
Yes, sir.
Hello. Dr. Wage, we are on different locations. Myself and my residents, we are both in different locations. Without taking much time, let me present the different cases, what the way we had treated it with a case presentation. And after Pooja has presented it, I will come again to you people. May request Dr. Wage to allow my resident, Dr. Pooja Raut, who is exclusively working
Yes, sir. Yes, sir.
on this.
Dr. Shrikant, sir, make her co-host.
Yes, sir. Already.
Now, please allow her to. Okay, thank you. So again, I will join with you. Within 10-15 minutes, I will complete this administrative work, and again, I will be in touch with you. Anyhow, I will be there for your this thing. Okay. Thank you. So Pooja, please present the cases?
Yes, sir. Thank you, sir.
Okay.
Hello.
Yes,
Am I
ma'am, you are
audible, sir?
audible.
Yes,
Yeah,
yes,
please
yes,
go
you are
ahead.
audible. Okay.
Okay. Thank you so much, sir. Good afternoon, everyone. Myself, Dr. Pooja Raut, final year PG scholar from Kamar Vritta Department, Government Ayurved College, Usmanabad. Respected dignitaries, teachers, and my dear PG colleagues. First of all, I would like to thank Department of Kamar Vritta, Jupiter Ayurvedic Medical College and Hospital Nagpur for arranging such a nice national webinar on Balroga. I would like to thank my guide, Dr. T.Y. Swami sir, for giving me this opportunity to present over here. Today, I will be presenting some neuromuscular cases that we come across in our day-to-day OPD here at GSC Usmanabad. So, I'll start with the presentation. The first case, a 15-month-old male child was brought by his parents in our OPD with following complaints. Child was having difficulty in holding neck completely. He was unable to supinate from prone position and vice versa. Unable to grasp objects in hands. Difficulty in speaking, that is only cooing was present. On examination, the child had scissoring gait. When held upright, the toe walking was present. Cortical thumb was present. Baby had bilateral convergent squint and continuous drooling of saliva. On neuromotor examination, the examination revealed that there was a grade 3 power of muscles. The palpation of muscles was rigid. The resistance to passive movements was increased. Range of passive movements was decreased, and the posture of limbs was stiff. All this revealed that there is hypertonia of all the four limbs, and the deep tendon reflexes were exaggerated. The probable etiological factor for this was birth asphyxia, and on admission, the DQ of this patient was 13%. That is, the baby was delayed in all the four domains of developmental milestones. On admission, the age of the baby was 15 months. I will play this first video. In this video, we can see that the baby is unable to hold neck completely, and he is unable to supinate or roll over from prone position even after so many efforts. Okay, the baby is not able to hold his neck completely. After this evaluation and thorough examination, this baby was started with Bahya Upchar. That was a Sarvanga Snehan with Tirtel and Balatel, Sarvanga Shashtik Shali Pindasved, Kati Basti using Balatel, and Karma Basti, that is Majja Basti, was started along with physiotherapy. The Abhyantar Chikitsa included Medarasayan containing Kumar Kalyan Ras, Samvardhan Ghrut once a day, and Saraswata Rishta, plus the Jiva Pratisaran was given with Vacha and Akkalkara Churna. After the treatment of 6 months and continuous treatment efforts, the child was able to sit without support and started crawling. I will show you the next video. This was during the treatment. The Panchakarma procedures that were carried out in our hospital was, first of all, this is the Abhyanga procedure. Abhyanga provides nourishment due to its snigdha, mrudu and pitchal qualities, and it improves the blood supply to the muscles, relieves the muscular fatigue, and reduces stiffness. It stimulates sensory nerve endings of the skin and gives abundant sensory inputs. Abhyanga and Svedan together divert the doshas from Shakha to Koshta, and latter from Koshta dosh can be managed by Basti or other Panchakarma procedures. The second procedure in the second video, Shashtik Shali Pindasved is carried out. The rice is Snigdha and Balavardhan and Deha Dardhe fruit. Hence, the heat provided by bolus of rice dipped in dugdha increases the blood flow locally and relieves the muscle spasm, increases the tendon extensibility and provides pain relief. It also provides the nutrition to muscular tissue, thereby preventing from atrophy. The third video is here the Katibasti procedure is carried out. Katibasti is a musculoskeletal treatment for disorders that involve muscles, ligaments, bones, vertebrae, and nerves. The benefits of these treatments are many, as the use of heated oil and the specific technique used result in profound healing process. The treatment not only repairs the damaged tissue but also rejuvenates the area. Now we'll see the improvement in this patient. After the continuous treatments of 6 months, the child was able to sit with support, also without support. He is leaning forward with control. You can see in the video. So there is much more improvement in neck holding. In second video, we can see that the baby is able to bear his weight on 4 points. He is crawling forward 10 steps, turning around and returning back to the original position. Now, after the treatment of 11 months, the child is trying to stand up with support from high knee position. And this was our achievement after the 11 months of the treatment. Next slide. This was the case number 2. A 2.8-year-old male child was brought with the following complaints. The child was unable to sit without support for longer time. He had difficulty in speaking with associated complaints like scissoring gait, toe walking, and convergent squeal. Hypertonia of both lower limbs and muscle power was 3 out of 5. The detailed neurological and developmental examination revealed that all the 4 domains of developmental milestones were delayed, with gross motor component being affected the most. The etiological factor for this case was birth asphyxia. The baby didn't cry immediately after birth and had NICU admission for 15 days. On admission, the DQ of this patient was 28.5% and the GMFCS score was 19.6. We will see the video. In this video, the patient is sitting, but he is not bearing his weight on his own. He needs the support of the upper limbs. Next one. The treatment plan for this patient was, in Bhaya Chikitsa, he was given the Sarvanga Snehan with Triyotel plus Balatel. Sarvanga Shashtikshali Pindasved was given. The Shirodhara was done using Tiltel plus Jyotishmati Tel. And as the child was very cooperative and playful, the Netra Darpan Kriya was also done using Shatavari Ghrut. Mustadi Rajapan Karmavasti was carried out for 30 days along with physiotherapy. For internal medication, the patient was given Medhya Rasayan with Yogendra Ras, Saraswata Rishta, Samvardhan Ghrut 2.5 ml OD empty stomach, and the Jiva Pratisaran with Vacha plus Akarkara Churna. We can see the improvement in this video. After the treatment of 6 months, the child is able to grasp the rod, he is able to bear his weight, and he is trying to stand up from this 4-point position. In the next video, we can see that after completing the 6 months of treatment, the child was able to walk with support with consecutive feats. His DQ on discharge was 19.6% and the GMFCS score was 40.2, which was a good score. Next. Now moving towards the next case, a 10 months old female child was brought to our OPD with complaints of difficulty in holding neck and sitting with support. A 10-month-old baby is generally expected to walk with support, but in this case, the child wasn't able to hold her neck completely, and there was a difficulty in rolling over. She was born to a primary mother with full-term normal delivery. She cried immediately after birth. She had a birth weight of 1.5 kg, that is very low birth weight, which was apparently the cause for her delayed development. On neurological examination, it showed normotonia. There was normal posture. All the reflexes were normal. Cranial nerve examination was also normal. So apparently this was a case of global developmental delay with developmental quotient of 23% and GMFCS score of 13.9% on admission. We will see the video before treatment. The baby is in pull to sit position, that is head is in midline. She is able to lift her legs and activate her trunk muscles, but there is the head lag. She is not able to bear the weight of her head. In second video, the examiner is trying to gain her attention, but the baby is not giving that attention. She is not grasping the object. She is not paying the attention. This baby was treated. A lot of emphasis was given on Bahya Upchar, that is Sarvanga Snehan with Kshirbala Lakshadi Tail, Sarvanga Shashtikshali Pindasver, and the Katibasti was given with Balatel. The internal medication included Meddarasayan with Kumar Kalyan Ras and Guduchi Sattva, Saraswat Grut for once a day with honey, and physiotherapy was advised with proper diet. We'll see the results after 4 months of treatment. The age of the child was 16 months. Now in this video, we can see that the pull to sit maneuver is elicited perfectly. The trunk muscles are activated and there is good chin tuck and full activation of lumbar spine. Okay. Now in next video, we can see the baby is sitting on her own without support. She is able to bear and maintain her own weight without any assistance, and she is leaning forward with control with support. Play this video again. This was after the treatment of 4 months. Now in next video, we can see that the improved social skills and understanding. The baby is following her mother's commands or tries to mimic her and waving a bye-bye. Okay. This was achieved after the treatment of 4 months. Now moving towards the next case, this a 1.5-year-old male child was brought to our OPD with complaining of unable to sit without support and unable to talk properly. On neurological examination, the baby was normotonic, normal muscle powers, all the deep tendon reflexes were normal, and the probable cause of his delayed development was low birth weight. The developmental quotient and GMFCS on admission was 16.2. After the treatment of 8 months, the baby was able to walk without support. Now, in the first case, it is the photo. This was the first time when he sat without support during nebulization in our IPD. So we took this photo of him. After the treatment of 8 months, the baby was able to walk without support. We can see in the second video. He was able to walk forward and climb the stairs, both feet on same step with support in this third video. The baby was able to walk with support and climb the stairs, both feet on same step with support. After the treatment, the DQ was improved to 56% and the GMFCS score was improved to 75%. Moving towards the next case. This is a 1-year-old male child brought to our OPD having hypertonia of all the 4 limbs. He had bilateral squint, grade 1 muscle power with normal cranial nerve examination. Now in this first video, before treatment, the age of baby was 12 months. We can see that in this video, during the pull to sit maneuver, there is complete head lag and the child is not able to engage the truncal muscles. There is no engagement of hand muscles seen. We can see this again. There is complete head lag. The child is not even trying to bear his the weight of his head. The treatment given to this child was in Bahya Upchar, Sarvanga Snehan with Tirtel plus Balatel was given. Sarvanga Shashtikshali Pindasvid was given. Shirodhara with Tirtel plus Jyotishmati Tel was given. And Mustadi Rajapan Karmabasti. Abhyantar Chikitsa included Meddarasayan with Chaturbhuj Ras and Samvardhan Grut, along with physiotherapy. Now, after the treatment of 3 months, when the baby's age was 15 months, the same maneuver is repeated and this time the child is trying to hold the neck. We can see in the video All the truncal muscles are engaged and the legs are moving. The child is trying to hold his neck. Again, play the video. Yes. The pull to sit maneuver is perfectly elicited. The truncal muscles, legs are moving, and the child is trying to hold his neck. Now, play the video. In this video, we can see that the child has held his neck in upright position for more than 1 minute, and the movement of legs was present. In next video, here during ventral suspension, we can see the upright posture of neck and strength of the spine is regained. So our treatment worked in this child very finely. Okay. Now moving on to next case. This is the case of 4-year-old female child having a perinatal history of birth asphyxia due to delayed labor. The child had 15 days NICU admission for the same. On admission, the complaints were unable to stand with support, unable to speak words properly, and difficulty in grasping objects with hands. On examination, this was a case of spastic cerebral palsy leading to hypertonia of all the 4 limbs, more expressed in upper limbs. The muscles were rigid on palpation, power of muscles was grade 4, the range of passive movements was decreased, the resistance to passive movements was increased, all the deep tendon reflexes were exaggerated and typical case of cerebral palsy. Line of treatment for this patient was Sarvanga Snehan, Shashtik Shali Pindasved, along with physiotherapy, and Shiropizo was given with Tirtil. In the first video, we can see that the child is not using her upper limbs for lifting that phone because there is more pronounced hypertonia. She is using her lower limbs. There was more spasticity in her upper limbs and the cortical thumb was present. There is convergent squint, microcephaly, we can see in this case. After the treatment of 10 months, while in second video, we can see that the child is walking with support after the treatment of almost 10 months. The spasticity of lower limbs got reduced and with little assistance, the child enjoys walking. Okay, moving on to next case. This was one of the challenging cases we have seen in our OPD. This was a diagnosed case of Joubert syndrome with stigmas like periauricular tags were present, depressed nasal bridge, high arched palate, squint, polydactyly, and hypotonia was present. On admission, the age of the patient was 15 months. We can see in this first video, she is unable to hold her neck. Previous. The child is unable to hold her neck. She is sitting with support in her parent's lap. Treatment given to this patient was Mederasan, including Kumar Kalyan Ras. The patient was unable to swallow this solid this. That's why the patient was given this Savardhan group. Shashtik Shali Pindasved and Sarvanga Snehan was the treatment given in Bahya Upchar, and Mustadi Rajapan Karmabasti was given. After the treatment, at the age of 2 years, we can see in the second video, please play the video. The child is able to coordinate. She is able to she is listening to her mother's commands. Her fine motor skills are more developed. The child is trying to grasp that object in her hand. Okay. In the next video, at the age of 2 years, the child is able to sit without support on the chair. Okay, next. Fine motor and cognitive skills were developed like this. In the first video, we can see that the child is able to obey the commands given by her mother. She is able to grasp that ring in her hand. In this video, she is obeying the commands of her mother. She is enjoying the music. She is trying to mimic her mother. Okay. And this third video, we can see the hand to mouth coordination that developed after the age of 2 years and a continuous treatment of 10 months. The child is enjoying her food. She is trying to put the food, to grasp the objects and put it in her mouth. Moving on to the next case, this is a 1-year-old child, typical case of cerebral palsy having hypotonia. The etiology of this case was birth asphyxia due to delayed labor. The baby didn't cried immediately after birth. On admission, the DQ and GMFCS of this patient was only 6%. The main complaints were difficulty in holding neck and difficulty in sitting without support. In the first video, we can see that her mother is holding her. She is unable to bear her weight on her own. After the treatment of 4 months, the line of treatment of this patient was Sarvanga Snehan with Tel plus Balatel. Sarvango Shashtikshali Pindased was given. Shirodhara, very vigorous treatment was given. Shirodhara was given with Tirutel plus Jyotishmati Taila. Mustadi Rajapan Karma Basti was carried out for 30 days along with physiotherapy. The internal medication included Medarasine with Chaturbhuj Ras and Guduchi Sattva. The Savardhan Grut was given once a day, and Jimva Pratisaran for drooling of saliva was given with Vacha plus Akalkarachum. After the treatment of 4 months, the child is able to sit without support for at least 10 to 15 seconds. She is enjoying sitting and she's trying to move her hands in different positions. She's trying to grasp objects with her hands. Next video. In this video, we can see that even after having this pronounced hypotonia, the baby is trying to lift her legs and trying to step forward with support. She's trying to move forward and she's stepping forward. Okay. So these were the cases we have seen in our OPD here at GSC Usmanabad. This is the GMFCS score sheet that we use for the neurological examination of the patients. This GMFCS means gross motor function classification system. It is designed to describe the levels of functioning of these patients. These are the 88 scoring techniques. Here are the 5 levels of GMFCS, where in level 1, people in level 1 has ability to walk independently, but may have some visible differences in how they walk. In GMFCS level 2, people have some awkwardness but can walk on their feet with some assistance like walker. In GMFCS level 3, these are capable of walking using a handheld mobility device, means they will be in the wheelchair, but they are able to use that wheelchair manually. On GMFCS level 4, physical assistance of 1 to 2 people is required for the transfer of this patient. There is they may operate a powered chair or otherwise transported in a manual wheelchair. In GMFCS level 5, these youth are transported in a manual wheelchair in all settings, and youth are limited in their ability to maintain anti-gravity head and trunk postures. Our traditional approach to children in level 4 and 5 was to give them lots of therapy. We would argue that providing powered mobility at a very young age is profoundly important for their motor development, social development, and language development. Thank you so much, everyone, for your patient listening. I would like to thank my guide, Dr. T.Y. Swami, sir, for giving me this opportunity to present here again. And over to you, sir. Thank you so much.
Thank you, Dr. Pooja Raut, for your scientific explanation about the various cases treated with the Ayurveda therapy. Sir will come in or what, Dr. Pooja? Will sir continue now again? Hello?
Yes, sir. Sir will join us, sir.
Yeah, okay.
Hello.
Yes, madam.
Yes, Dr. Pooja.
Sir, my colleague, Dr. Pooja Rathod, will continue the presentation.
Okay. Welcome, Dr. Pooja.
Over to you, Pooja.
Thank you so much, Dr. Pooja. Now we'll move on to see some other cases we manage with the Ayurvedic treatment in our hospital. Am I audible, sir? Hello?
So, but the voice is quite low.
Hello, sir. Am I audible?
Yeah, it's quite better right now.
Thank you so much, Dr. Pooja. Now we will move forward and we'll see some cases that we manage with Ayurvedic treatment in our hospital. Let's see one by one. For the first case, a 3.5-year-old female child presented with the complaints of generalized skin erythema, scaling, and itching since 5 months. Patient received treatment twice but didn't get satisfactory result. This was the case of exfoliative dermatitis. The treatment given was for external application. The Nimbakalka and Shatadavta Gruta was advised, and Takradara was given for 21 days. And for the internal medication, Arogyavardhini Vati and Gandhakrasayan was given for 21 days. So here we can see after 10 days of treatment, the scaling and erythema of skin was decreased. And after the 21 days, there was complete reduction in the symptoms of the patient. Now we will see the second case. 13-year-old female child presented with complaints of maculopapular rash over left leg and itching at that site since 15 days. This was the case of atopic dermatitis. Treatment advice was the QT soil for local application, which contains Nimbak, Karanja, and Bakuchi Churna. And for the internal medication, Arogyavardhini Vati, Gandhakrasayan, and Triphala Churna was given for 14 days. So here we can see the gradual decrease in the symptoms. The next case, a 1-month-old male child presented with the complaints of peeling of skin over face, erythematous rashes over body, and watery discharge from both eyes since 1 day. This was the case of 4S, that is Staphylococcal scalded skin syndrome. The Nikolsky sign was positive. The treatment given was, along with the fluid management, the internal medication advice was Septalian drops containing Guduchi Yashtimudyan Gugur, which has the antimicrobial property, which helps in the 4S. And for the local application, Shatadavta Grut along with the Chatyati Tel was given after 7 days. Here we can see the result. The next case, a 10-year-old female child presented with the complaints of whitish patches over left iliac region since 1 year. There was no itching and no discharge present. This was the case of vitiligo. Along with the dietary advice, treatment given was for external application, the mixture of Bakuchi Churna with Hartal Basma mixed in Gomutra was given. And for the internal medication, along with the Arogyavardhini Vati and Gandhakrasayan, the mixture of Bakuchi Churna, Tamra Basma and Guduchi Sattva, along with mud given for 21 days. So here we can see the hypopigmented patch getting the normal color of skin, which is the recovery sign. And the next case, a 16-year-old female patient presented with the wound at left leg, along with the pus discharge and pain at that site since 5 days. The patient received antibiotic for 5 days, but didn't get satisfactory result. So this was the case of insect bite. The treatment advice was, the wound was cleaned with the Triphala Quat, and for the local application, Jatyadi Tel and Brahmanarupak Tel was given. In the internal medication, the mixture of Rasamanikya, Guduchi and Mustav Churna was given, along with the Arogyavardhini Vati and Gandhakrasayan for 21 days. During the course of treatment, there was a gradual proliferation of granular tissue seen. Other symptom reduced and complete healing of wound can be seen after the 3 weeks of treatment in this picture. A 7-year-old female child presented with the complaints of maculopapular rash over back and itching at that site since 5 days. This was the case of some fungal infection. The treatment given was Nimbatel for local application along with the Eladi soap containing Ela, Keshar and Karpur for bathing, and the internal medication was given Gandhakrasan and Khadirashtra for 14 days. So after the 14 days of treatment, we can see the result in this patient. A 12-year-old female child presented with the complaints of maculopapular erythematous rashes over forehead and itching at that site since 5 days. The treatment advice for this patient was the mixture of Sariva, Manjishta, Haridra, and Nimbochuta for local application. And for internal medication, Gandhakrasan, Sukshma Triphala, and Krumikutar Ras was given for 7 days. So here we can see the result in this patient, and the maculopapular erythematous rashes was decreased after 7 days of treatment. In the next case, a 11-year-old male child presented with throat pain while deglutition since 15 days. The child has history of repeated tonsillitis. There was follicle seen on the tonsil. The treatment advice was gargles with lukewarm water with Haridra and Sandha. Hello. The internal medication advice was Kanchanar Gugul and Sukshma Triphala for 10 days. We can see the result in these photos after 10 days. Moving forward, a 17-year-old female child presented with the complaints of swelling over upper lip, slight swelling over face, periorbital edema, and itching all over body since 1 day. This was the case of angioedema. Along with the antihistaminic, the treatment advice was Haridra Khanda, Gandhakrasan, Gandharva Haritiki Churna, and Parivatadikvat for 7 days. As you can see in this picture, the periorbital swelling is reduced after 2 days of treatment, and after the 7 days of treatment, all above the symptoms were reduced. Moving forward, this one is a special case. A 1.5-year female child presented with complaints of anasarca, puffiness of face, abdominal distension, and retention of urine since 5 days. This was the classical case of nephrotic syndrome. We have managed this patient in our hospital. Along with the fewer modern medications like methylprednisolone and other fluid management, the Ayurvedic management given was Punarnavashtakvat, Sarpagandha Ghanavati, Gokshutadi Gugul, and Amrutarishta. This case was present to just let you know that we can manage such a critical patient with Ayurvedic management along with the modern medications. So with this concluding slide, I would like to thank Department of Kumar Vritya Jupiter Ayurvedic Medical College, Nagpur, and our guide, Dr. T.Y. Swami, sir, for giving us this opportunity. Thank you so much. Over to you, sir.
Thank you, Dr. Pooja Rathod, for your nice explanation with the various cases, how they effectively manage with the Ayurveda treatment. So you are working under Dr. Swami, sir. So very nicely you have presented it. So will sir join, or we have to wait for a few minutes? Dr. Pooja. Hello, Dr. Pooja.
Hello.
Yeah, will sir join, or we have to wait for?
Yes, sir.
Okay.
Just a minute, sir.
Okay. Meanwhile, I would like to request all the participants, those who are in query about various cases presented by Dr. Pooja and under the guidance of Dr. Sanu sir, they can type in chat box so that sir will look and will answer you accordingly. Meanwhile, Dr. Pooja Rathod, someone is asking you, please repeat the treatment of Anna Sarka. If you have time till the sir join, you can explain it.
Hello.
Yeah.
Hello, sir.
Yes.
Sir, Swami sir is asking you to unmute him. He's there.
Okay.
Just a minute.
Yes. Dr. Srikant, have you done it?
Yes, sir.
Okay.
Hello.
Yes, sir. Yes.
Hello. Thank you everyone for patient hearing. This is in a nutshell what our department is doing for all these years. Every year at least one of my students will be seeing not less than 50 cases of this neuromotor disorders. And it is a routine work for us. And few of areas where we concentrate is especially with CPs and their cognitive and motor development. What I want to address to all my participants is that everybody might be working on this field, but we had a protocol prepared for the government of Maharashtra also. First few days, I think it is audible. I think, hello, now it's audible. Okay. We made a protocol for the government of Maharashtra regarding this neuromotor disorders for the children. And in that we made it in a point that and not giving any haphazardly any medication. We made a protocol first 1 week. We don't let the patients to have any medicine. First 1 week we go only for this Panchakarma. And then we will be, I'm audible?
Yes, sir. Yes.
First 1 week we just go for the Panchakarma and make the history very complete. And especially while we are planning for the treatments, there is a schedule of treatment like for one Rasopharis, one growth and one Aswaris. Like it is in a pattern of the treatment. While making our major assign, depending on the different complaints, like many children had the associated complaint of the conversions. For them, we add some other sort of medication. Many children do have a language problem more than other problems. We had a list of our prognosticating criteria. For example, we go for the eye-to-eye contact, and the child is able to sit for less than 2 years of the age. We believe that the child can be improved very well with the treatment of eye. At last, I want to conclude that every treatment what we are giving may not have any evidence to show its effects, but absence of evidence of an effect will not conclude that this is an absence of an effect. It cannot be evidence for the absence of an effect. Ayurvedic medicines really does help, and moreover, to elevate the apprehensions that using Rasaushadhi in children, many people fear for that. But all the cases, wherever we are giving for more than 3 months, we go for their LFT and KFT. We had the profile of their liver and renal profile. Even we take a survey from all the nephrologists to our vicinity places, whether any cases being treated by us or anybody else within Ayurvedic medicine, especially metallic preparations, Basma preparations and gold preparations. We use it very frequently and very vividly we use it, but we do not get even a single case of toxicity of the metals. It is an important thing to all my youngsters who are aspiring to have a career in Walro without any hesitation. A reputed company or a good prepared medicine of Rasaushadhi can be used it. And to say word ahead that unless you use a Rashtrasati, you cannot expect that a chronic disease of the children can be cured. And I think my time is over. I thankful once again to all the participants, and I hope Dr. Roshni is there on this one for our lecture. I'm thankful to everybody, and I'm once again thanking Mr. Wage for giving this opportunity. Thank you. If you had any query, please you can post your query, this one questions to us, either to our Pooja Rathod, Pooja Raut, both of them. You can send your questions by mail also. They will be leaving your mail ID or else WhatsApp. You can leave any question from any participant. If not in this session, for any time, you can please send your questions and feedback also. Thank you.
Yes, thank you, sir, for being with us. Being a very busy schedule, you have given time for sharing experience thing regarding the Kumar Bhattacharya and Ayurveda, role of Ayurveda in the management of various neuromuscular disorders. So now I would like to invite Dr. Nitin Wagmare, sir, Head of Department, Professor Balru from Sumatibai Shah Ayurveda College, Hadapsar, Pune, to moderate this session. Sir, so over to Dr. Nitin Wagmare, sir. So welcome, sir.
Thank you, T.Y. Swami, sir, for your kind and knowledgeable lecture. As we all know, you have created a very good setup, very good Panchakarma setup, and you are already treating very nicely the neuromuscular disorders and many more conditions. So we thank you, Dr. T.Y. Swami, sir, and Dr. Wage, sir, for organizing this nice webinar. Sorry. Thank you.
Okay. Thank you, Dr. Nitin Wagmare, sir, for your remark on this lecture given by Dr. Swami, sir. How they effectively managing various cases of neuromuscular disorders. We have seen case by case with their student under their guidance. So thank you, Dr. Nitin Wagmare, sir, and Dr. Swami, sir. Thank you again.
Dr. Sundar, sir. Dr. Sundar, sir, just a minute.
Yes, sir.
I want to thank Dr. T.Y. Swami, sir, who is my guru and my mentor. We had a great time in Government Ayurvedic College some 20 years back, 25 years back. At that time, I was really blessed to have his company, and his guided me on many of the cases, and I was lucky enough to get the knowledge from him, and it was very nice to see him after so long gap, and because of this webinar, I was again able to communicate with him. So I thank him very much for sparing time with us and sharing our platform within a short notice. And similarly, I thank Dr. Nitin Wagmare, sir, who had agreed to moderate the session on very short notice. And we will, with this, we will move on to the next part of the program. Over to you.
Thank you. Thank you.
Thank you, sir.
Thank you, sir. Thank you, Swami, sir. Thank you, Wagmare, sir.
Thank you. Thank you.
Thank you.
Now I would
Thank
like
you.
to thank you very much. Now I would like to request Sundar Singh Danga, sir, to please introduce our next guest speaker and invite her. Over to you.
Thank you,
Dr.
Dr.
Sundar, sir.
Srikanth, sir. Thank you. Now I would like to introduce our next speaker, Dr. Roshni Anirudhan, ma'am. She is a professor, head of Department of Kumar Bhattacharya Government Ayurvedic College, Kannur. Ma'am has done post-graduation in 2002 and in Sanhita Siddhant, and 2009 Kumar Bhattacharya from Government Ayurvedic College, Thiruvananthapuram. Dr. Roshni has also done the PhD from Kerala University on childhood autism in 2020. Ma'am has also completed basic life support in pediatric, that is advanced life support by American Heart Association. Ma'am has near about more than 20-year clinical experience in the Department of Kumar Bhattacharya. Dr. Roshni has awarded the Best Doctor by Atri Award in 2019 by the Government of Kerala in the contribution of field of our Ayurvedic practice. She has also working as a best project coordinator in 2019 by the Government of Kerala on Snehadhara project, which is from government funded project. Dr. Roshni was the first runner-up in National Level Research Award 2010 in Ayurvedic Management of Cerebral Palsy in Children conducted by the Kerala Ayurveda Limited. Snehadhara is Ayurvedic Management of Development Disabilities in Children coordinated by Dr. Roshni, and she was selected as a model project in the healthcare sector, and she has contributed to achieve the Gram Swaraj Trophy by the District Panchayat Administration and as well as the state level in 2017-18. That is in the Panchayat Puruskar in national level in the year of 2017-18. She is a principal investigator of research on Ayurvedic management of childhood autism in collaboration with Rajiv Gandhi Institute of Biotechnology, that is evaluating on neurotransmitter and epigenetic variation. Next project, integrative approach of the management of specific learning disability, funded by the Center for Disability Study in 2019. She is also principal investigator of the project Mild Persistent Bronchial Asthma in Children with Ayurvedic Management and Yoga Therapy, which is funded by state government, conducted by the Department of Komar Bhattacharya at the Government Ayurvedic College Trivandrum in 2019. Ma'am has also presented many research papers in national and international journals. Madam is PhD and MD guide. So welcome Dr. Roshni ma'am to deliver our next lecture. Over to you, Dr. Roshni ma'am.
Thank you for the nice words. Am I audible?
Yes, ma'am. Yes.
A very warm good afternoon to one and all. I wholeheartedly thank the organizers of Jupiter Ayurveda College, and I am overwhelmed to know that you are organizing a series of seminars, especially in this pandemic scenario, so that we are updated in our science and it's benefiting the juniors also. And I'm extremely thankful that I'm being invited to present a paper on epilepsy management and the seminar concerning with Kaumaramartya. Once again, thank the organizers, Principal Subhash Vage sir and all, especially after the brainstorming session by Swami sir, I'll be starting my presentation. Can I share the screen?
Yes, ma'am, sure.
Is it visible?
Yes, yes, ma'am.
So directly into the topic, management of childhood epilepsy. Firstly, at an outset, we should know what's a seizure and what's an epilepsy. A seizure is actually a paroxysmal time-limited change in the motor activity or the behavior, which is resulting from the abnormal electrical activity of the brain. It happens in almost 10% of the children. And most seizures are provoked by high fever, hyperparaxia, any infections, hypoglycemia, hypocalcemia, any head trauma, hypoxia, etc. can precipitate a seizure. But this seizure is entirely different from epilepsy. Where seizure is only a sign, epilepsy is a disease. Epilepsy is a condition in which seizures are triggered recurrently from within the brain. So it's a condition where seizures have a neurological origin. Now we are dealing with epilepsy. Then causes of epilepsy is usually, can be divided into three. That is, endogenous factor plays a major role, especially in pediatric population, where the age or under maturity of the brain itself forms a increase or decreases the threshold level to precipitate a seizure. So age itself is a risk factor to get a seizure attack. Then moreover, genetic abnormalities, which is common in this age, and moreover, certain prakritis like Paithika prakritis are having more prone to get seizures. And after completing this endogenic factors, we are directly coming to epileptogenic factors. This is the actual reason behind that epilepsy. That reason is strong enough to produce an epilepsy of its own. Usually the epileptogenic factors are infections which happens in the brain, head trauma, or hypoxic insults which happened in the brain. It's actually the real reason behind that epilepsy. And the third one is precipitating factors. As you all know, epilepsy is having a Vegavastha and Avegavastha. So even in the presence of this epileptogenic factor, one precipitating factor is needed to have to precipitate the disease. It may be factors which increases the Rasadhatu Dushti. So we call it as precipitating factors. Anything like sleep deprivation or increased stress levels or hormonal variation can all act as precipitating factors. So we classify the causes etiology into three, that is endogenous factor, which is in which pediatric age group is more prone. Then the real cause of epilepsy, that is epileptogenic factor, and the third one, that's a precipitating factor. We'll think of it later and while planning the management. So epilepsy is an interaction or dynamic interplay between these endogenic factors, epileptogenic and precipitating factors. Then causes of epilepsy varies according to age. Usually in early neonatal period, hypoxic ischemic encephalopathy, which happens usually at the time of the delivery, is a major cause. Birth trauma can be a cause. Intracranial hemorrhages can cause seizures. CNS infections like meningitis, encephalitis can cause. Congenital brain abnormalities can cause. So that's the usual cause in the early neonatal period. Why? In later age, like when the baby is nearing the age of 1 year and up till the age around 5 years, the usual cause of seizure is febrile or fever. Febrile seizure, that is with or without CNS infections, is the major cause of seizures. Because the hypothalamus, you all know that hypothalamus is the main organ which is controlling, which is supposed to control the temperature. As the hypothalamus is not fully functional until the age of 5 years, these kids are finding very difficult to manage the temperature. So with an increase in temperature like hyperpyrexia, these kids, chance of these kids to throw seizure is very common under 5 years. So typical febrile seizure doesn't have a brain pathology behind. It's just only an expression of the hyperpyrexia. So 5 factors are mandatory if you should designate it as a typical febrile seizure. Because I am separating this typical febrile seizure from my presentation on epilepsy because it's not a pathology related with brain. But it's too common in pediatric practice. You should know that the typical febrile seizure happens only when the baby is having hyperpyrexia, and essentially it's an effort of the body to control the temperature. So vasodilatation should happen with convulsive movements of the body parts, and it won't last more than 5 to 10 minutes. No residual damage to either to brain or body won't be there, and the body will be effectively able to control the temperature. 5 points makes it different from all other seizures. Typically associated with hyperpyrexia, baby should be under the age of 5 years. It should be essentially a convulsive attack. Maximum duration should be 5 to 10 minutes. No residual damage should be there, and baby should be able to control the temperature. If the baby is having any CNS pathology behind, so a mild increase in temperature itself is enough to produce a seizure attack. Such a seizure attack, we call it as atypical, or it is different from the typical febrile seizure. We call it as atypical febrile seizure. It can happen even with a small increase in temperature. It won't be mandatory convulsive attack. It can last more duration, and it can cause residual damages also. So it's different. So this febrile seizure, which is common in pediatric age group, doesn't demand any management like the epilepsy protocol. Just your effort should be helping the baby to control its temperature. So typical febrile seizure management follows the Paithika Jwara treatment protocol. Usually more than the internal medication, external therapies can help the baby to control temperature. Subcutaneous absorption is very nice in this age group. So Talam, which we call like external application of medicated paste on the anterior fontanelle. In Kerala, we call it as Talam. Is very nice in managing the temperature. We usually do it with kachuradi or churna or any pitta shamana churna mixed with butter. Mixed with butter is very effective in managing the temperature, especially if the baby is of Paitika nature. So external application of such a medicated paste on the anterior fontanelle, then external application of chandana churna mixed with milk on the forehead, cold water sponging, use of antipyretics, everything help in managing the temperature, and so that febrile seizure is automatically managed. While in atypical febrile seizure, the condition is different and it demands an epilepsy management protocol. So after this age group, when it reaches the childhood, the causes of seizures are different, usually neurological deficits, genetic abnormalities, development disorders like cerebral palsy, everything will be cause of seizure. But in late adolescent, usually catamenial seizures is the main cause in adolescent nature. Catamenial seizures is usually associated with hormonal changes. Usually that feminine hormones come into role as, during the adolescent period, and the child faces difficulty, and that's the catamenial seizures. Then brain tumors, head trauma, etc. come into role in this age group. So anyway, coming to the mechanism of seizure, how the seizure happens. There should be a brain damage inside. That's a neurological deficit inside the brain, which is potent enough to generate a burst discharge. It's generating a excitatory discharge from the brain, and the inhibitory system, like GABA inhibitory system, will be slow working, so as to inhibit that excitatory response. That's a mechanism of seizure going on. Coming into classification of seizures, seizures can be usually classified as focal, generalized, and epileptic encephalopathy. Focal seizures happens only in a part of the body, wherein the generalized seizure, the full body is involved. Like we come into classification of focal seizures first. So it's a mildest type of seizure where only a part of the body is involved, or you can say that only a region or minor area of the brain is also involved. The simplest form is simple partial seizures, where consciousness is usually retained. Baby will be conscious. He may be experiencing a sensory abnormality or autonomic abnormality, or either a motor deficit. Then when proceeding to the other type, that is complex partial, bit more complicated, where consciousness can be impaired, much body parts are involved. And the third one is partial seizure proceeding to secondary generalization. I think I will speak it through videos. So we are dealing with the classification of seizures. The first one is partial seizures, which we are detailing now. Again classified into three: simple partial, which only a part of the body is involved; complex partial, which a major area of brain is involved, where consciousness is also lost; and the third one is partial seizures tending to be generalized, means it starts as a single part of the body and tending to involve the full body as a whole. Then coming to generalized seizure, which I will explain later. So coming to simple focal seizure first, it's lasts less than 1 minute, is usually a single part of the body is involved. Consciousness is there. Can you see the video?
Yes, ma'am. Yes.
Can you see the hand of the baby? Baby is having the seizure attack now. Only the hand is involved. The baby is conscious. Baby is watching what is happening to my hand. It's simple partial. Is it clearly seen? That is simple partial. Only the hand was involved. Should I repeat it? Can you see it?
Yes, madam. It was quite clear.
Okay. Now another simple partial. I think you can appreciate the flickering movements of the eyelids. Baby is conscious. Now coming to the next classification of partial seizure, that is complex partial seizure. Here, consciousness may be usually altered and duration is much more. The same baby who had, now see the lip smacking movements, eyes thrown up, and see the respiratory rhythm change. You can see the arrest of respiratory rhythm in between. And hopefully you can appreciate the cyanosis setting in on the lips. Another complex partial. See the change in rhythm of respiration. And arrest is the again. Now we have completed the simple partial and the complex partial. Now moving on to the partial seizure tending to be generalized. That I was stated. It will start as single part of the body, then it will proceed to the full body involvement. You can see in this picture. Baby has started the lip smacking movement. See, it is started in the left forearm. No other body part is now involved. Left forearm now. Cycling movements of the lower limb started. It's proceeding to the lower limb. And the involvement of the right arm also is there now. That is, seizure is marching from one side of the body to the full body. That is called Jacksonian marching of seizures. Named after the famous dancer Michael Jackson, as if he is dancing in the Dangerous music album, starts from the one side of the body, slowly spread to the full body. Jacksonian marching of seizures. Another case started in the upper limb, now involving the lower limb as well. I think the videos are clearly visible. Hope so. Is
Yes,
it
ma'am,
visible?
yes.
Okay.
Yes, madam.
Now we have completed the partial seizures. And we are coming to generalized seizures. Generalized seizure means the full part of the brain is involved in making the seizure, and the electrical discharge has spread to the full brain. Usually the consciousness will be lost, usually. And the simplest form of generalized, you all know that generalized seizure is much having a greater gravity than the focal seizures, because the full brain is involved. Now, among the classification of generalized seizures, the first one is absence seizure, where there is just an absence. Is the baby won't be, the tone of the baby won't be lost, baby will be active, but 1 second, one or lasting from 1 second to 5 seconds, there will be a blank stare, like no other deterioration will be there. That's the mildest form, absence seizure. Second one is tonic seizure, when the body tone is increased. Then atonic seizure, when the tone is lost. Myoclonic seizure, where myoclonus will be there. Then clonic seizure, then clonus will set in. And the final one is generalized tonic-clonic seizure. So we will go through videos. After the absence seizure, we are talking now about atonic seizure. Here in atonic seizure, it forms like drop attacks. Baby will be standing as normal, and suddenly, without any pre-ictal discharges or anything, baby won't be knowing that he is going to develop this seizure. You suddenly start a seizure attack. That's why we call it as drop attack. Suddenly. See, this is a drop attack, lasting only for a few seconds. Again, the baby is normal. See, the drop attack. If the baby is standing of his own, the chance of having the head injury is much more in this case. So we usually ask them to wear a helmet to prevent the head injury. Here the baby had a drop attack, and after this attack, he was sitting on the chair, had a drop attack, and has not still regained from that attack. This is the helmet which we ask them to wear to avoid the head injury. Again, this second baby. And the third one is myoclonic seizure. Usually myoclonic seizure, a group of muscles go into contraction to form a myoclonus. Both the upper limbs and the head will jerk like. See, it's very short span duration is the lasting for less than a second. Now the third attack, fourth attack. First attack, second, third, fourth, fifth, sixth. The duration of myoclonic attack is very less, but the frequency is very much more. It happens like 20 or 30 or maybe more than 100 times in a period of 5 seconds. You can see the mild myoclonus setting in. For this baby, the focus is very big because she met with a road traffic accident, and right side of her skull can see, I think you can see, had a big hematoma, and the site of lesion is very big. So that myoclonic attack is involving in the full body. It's a whole. The way you differentiate a myoclonic attack is it's very brief, it's very short-lived, but frequent attacks. The next one is tonic seizure, where the tone of the baby is increased. See, the seizure has started already. I didn't get the video from the beginning. The tone of the full body is increased. Something like ayama. Now it is releasing. Seizure is subsiding and the tonus. See the lower limb tone also it's regained. See, again a tonic attack. Left upper limb and right lower limb. Now coming to the, the severest form of epilepsy, that is generalized tonic-clonic seizure. Usually happens in adults. It doesn't happen in very young kids because the seizure, even though abnormal brain discharge is there, that this abnormal discharge has to happen for a longer duration in the brain. So it has 4 stages. Pre-seizure phase is the baby will be knowing that I am going to develop a seizure. Pre-seizure phase is the a tonic phase of attack is the then followed by clonic attack, and a post-seizure phase will be the 4 phases will be the pre-seizure, tonic phase, clonic phase, and a post-seizure phase. Usually pre-seizure, as there is a pre-seizure phase, baby will adopt a safe posture somewhere like in the lap of the mother, or baby will go around the bed and try to sleep, try to lay down in the bed. So chance of traumatic injury is very less in generalized tonic-clonic seizure. Tonic phase is always the, so usually the tonic phase is usually associated with tongue bite and all. Injuries are usually associated with tonic phase. Then clonic convulsive movements will be the later followed by a post-seizure phase where the baby will usually go to sleep. I didn't get the tonic phase here. This is the clonic attack going on. During the tonic phase, the detrusor muscles, everything go into contraction, and usually defecation and urination happens during that time. And now is the clonic phase going on. Frothing from the mouth, you can see, I think. So the advantages of classifying seizure like partial, generalized, everything is that it usually gives a clue to the cause of the seizure. And it's helpful to make a prognosis of the seizure also. Usually generalized seizures are having a more gravity and bad prognosis than the focal epilepsies. And this type of seizure also allow you to select the appropriate treatment for that. Then coming to epilepsy syndromes. which is not a major concern in my presentation today, because they are epileptic encephalopathies, where here the epilepsy comes as a Swadhantra Vyadhi itself, and this epilepsy again worsens the neurological, worsens the brain tissue and causes the neurological damage in the brain. So as you all know that seizure happens due to a defect in the brain or a brain trauma or a defect in the brain. So from this defect, a seizure originates or an epilepsy originates, and the epilepsy becomes so potent that this epilepsy again worsens the brain damage, and the seizure for focus of the epilepsy goes on increasing. That is called epileptic encephalopathy. Epilepsy again triggering the encephalopathy in the baby. That's epileptic encephalopathy. Many are there, they are called as intractable seizures, because the seizure is getting into a vicious cycle, and even all the anti-epileptic drugs are ineffective in managing such seizures, and usually the life expectancy is very much reduced in such cases. Lennox-Gastaut syndrome is the common form of epileptic encephalopathy, which we find in OP practice. And the next point we should have in the mind is true seizure versus pseudo seizure. Usually, baby may mimic a seizure, pseudo seizure. Usually, kids under 8 years don't mimic a seizure. They do have a seizure. But when the child reaches adolescent age, they start for reasons of maybe school escapism or parental care or attention seeking, anything, they start to mimic seizure. So you should be able to differentiate between a pseudo seizure and a true seizure. Usually injuries will be very less in pseudo seizure, and EEG abnormalities, if you take an EEG or even a video EEG, cannot trace out any abnormalities in a pseudo seizure, while you can chance of tracing an abnormality in EEG is very much in actual seizure. If you do a video EEG, then also it will be very informative. Then coming to Ayurvedic perspective, then only we can plan for the treatment. Ayurvedic perspective, usually the Vyadhi will be there, the innate brain abnormality will be there, usually Purusha Graha, like neurological deficits will be there involved in the baseline, or toxins will be causing a damage in the brain and serving as a cause for epilepsy. Then usually Ahida, Annapana, Viruddha Ahara, etc. complicate such pathologies, and mental agony, stress and all act as the precipitating factors. And you should consider the involvement of Sharira and Manasa dosha as well in framing the treatment. Acharya has classified in seizure into Apasmara into broad categories like Vadika, Paitika, and Kapaja, and Sannipadika. So, for a practical purpose, I'll try to pull out some points from the Vadika Apasmara. Usually, those seizures which are having a sudden onset, multiple episodes, short duration, and much frequency are usually Vadika nature. No pre-seizure phase will be there. Severe frothing can be expected in Vadika nature. And lack of sleep is the usual precipitating cause. And usually postictal headache will be seen. And while reading an EEG, hyperventilation is usually provoking. You can see that hyperventilation is potent enough to provoke a seizure. Then you can think of Vadika type. These type of seizures are usually that presence of Vata and all everything coming under the. As you all know, no seizure like this is single dosha involvement. So Anipadika dosha is there, but predominance of one or two dosha you have to identify. Then only you have to plan a treatment. And coming to Paitika Apasmara, usually associated with fever is the, or even you can see a rise in temperature after the seizure. Usually Paitika Pragritis are prone to develop this Paitika Apasmara. While doing an EEG, photic stimulation is usually inducing a seizure type in this Paitika Apasmara, precipitated usually by hunger. You can see that. baby, this girl, she has woke up from the sleep on the early morning, and light is coming from her friend, and she tries to look at the light. That photic stimulation is aggravating a seizure in her. She's trying to avoid the light. If she looks straight at the light source, she will be getting seizure. See, drop attacks. When she tries to see the light, it's drop attacks. Then the Kabaja variety, it's usually long duration epilepsies with pre-ictal phase and post-ictal Kabaja Shirashula, vomiting tendencies, etc. usually seen in Kabaja Abhasmara, and Agnimandiya is usually the precipitated cause, and increased sleep duration is usually finds as a precipitating cause. If the baby has an increased day sleep, the baby will be prone to develop seizure that day. So concerns in Ayurvedic platform is while managing Abhasmara, impaired Agni will be there, because defective digestion and metabolism will be there, so that metabolic waste will be getting accumulated in the bloodstream, which is causing it, which is serving as a triggering or precipitating factor. As epileptogenic factor has already happened, that brain trauma has already happened, so we have to rule out the precipitating factors now. Accumulation of semi-digested food can happen due to this impaired digestion and metabolism, leading to the ama formation, and systemic absorption of this ama or Thadugada ama can cause a precipitating factor, or Resadadu Dushti itself is a can act as a precipitating factor for the seizure. And you all know that as there is Vegavastha and Avegavastha, some evidence of Srodoroda is clearly seen in the manifestation of Abhasmara. And you all know that structural deficit in the brain is also there, along with the functional derangement. So the maturation of the deeper dhadus like Majja and Asti is usually deformed. Imbalance of the doshas will be there, but dominance of Vada and Pitta vitiation is evidently marked in an Abhasmara. So you have to plan different management protocols during the Vegavastha and Avegavastha. Management strategy which we adopt here is an integrative approach, because seizure management is usually an emergency concern, and ethically you are not allowed to withdraw the anti-epileptic drugs which is going on in the child. So with allowing the baby to be on the modern anti-epileptics, we have to start our Abhasmara Chilsa to improve that brain functions, to rectify that functional derangement, to improve that structural integrity and all. So first and foremost line is that you have to enlist what are the precipitating causes of the seizure, list out the precipitating causes and try to avoid that precipitating cause. And then second point is correct the Agnimandiya, because this Agnimandiya or generation of the Amatwa is a major precipitating cause behind all epilepsies. So correcting the Agnimandiya, removing the Rasadadu Dushti is the second aim. Then correct the gut-brain axis and manage the epileptogenic factor. This is a standard protocol which we use, which we do here in Kerala. This is my work experience from working at Government Ayurveda College, Trivandrum in epilepsy. Generally for the practical purposes, I do classify the seizure broadly into two Vada Kabaja dominant, Vada Kaba dominant seizures and Vada Pitta dominant seizures. Because Vada is involved in all the criteria of seizure. First we plan for a Pajana, because Sama Pajana is a major concern. If Prabhuda Ama is the, first of all we go for a Pajana. If that much Prabhuda Amatva is not there, we can directly enter into Dipana. Ama Pajana is usually done with Shaddaranam, Churnam, Illuadi Guliga in Vada Kabaja Abhasmara. And Kashaya option is Kalyanaga. Kalyanaga Kashaya is very effectively going on in clinical practice in many extensive parts of Kerala for managing Kapaja type of seizures. And it's clinically proven drug also. Kalyanaga Kashaya is very Deepana, Pachana, Sroto Shodhanam. All these triad all these three principles can be attained with Kalyanaga Kashaya. And for the attaining the Deepana, Ashtachurna and Shaddarna Churna is option in Vada Kabaja types. While going to the Paitiga type, Vada Paitiga type, usually Shadanga Kashaya with avoiding the Shundi, that is Nishundi Shadanga Kashaya is used as an Amapajana, which along with Sudarsana Churna is there. Because in Pitta involved condition, we usually use Tikta Rasa Pajana drugs. Sudarsana Churna is given there, and usually as the Ama has entered the deeper dhadus like Rasa, Rakta, Mamsa, Meda and all, we adopt the treatment of Dhadugata Jwara to get rid of that Matwa in the deeper dhadus. So we should adopt the treatment as told in the Jwara Dhikarana, that is Sama Jwara when reaches the Rasa dhadu, Kalinga Padolasya Patram Kadigirohini is there, Sandata Sadata Jwaram is told. Kalinga Padola Shariba Musta Pada Kadigirohini is there in Sadada Jwaranda. That treatment options is very highly effective in managing that, clearing the Tamadosha in deeper dhadus. Then after attaining that Deepana Pachana, we can go for Shamana. Again, Kalyanaga Kashaya can serve as a Shamana in Vada Kapaja varieties. While in Vada Paitika varieties, Brahmi Drakshadi and Drakshadi Kashaya has given wonderful results as a Shamana drug. Snehapana is an inevitable component for managing this Abasmara because of the affinity of that Majja Dhadu or Mastulaga Majja and its response to the ghee. So Snehapana can be used as Achapana as well as Vicharana Snehapana. Usually Vicharana is widely used in pediatric practice due to that drug tolerance, patient tolerance and all. Panchagavya Krida is an excellent drug option in Vada Kabaja seizures where Srodha is much more. Panchagavya gives a very nice Rodho Shuddhi and it's clinically very proven drug in the management of Vada Kabaja Abasmara. And Villu Panchanga Krida is another version of Panchagavya Krida where Villu is a single drug added over this Panchagavya. Villu Sarasa, Pushpa, so Panchanga of Villu is taken and Panchagavya Krida is prepared. And we had a clinical study using this Villu Panchanga Krida in our department, which I'll be elaborating in the last session. Mahapaishajya Krida, which is also available in the market, is very good in managing seizures with Vada Kaba dominance. While Vada Paitika dominance, we need more Pitta Shamana drugs. Kushmanda Swarasa Krida is very effective in managing Vada Pitta Shamana. Only 2 drugs are there in the yoga. Kushmanda Swarasa, 18 parts of Kushmanda Swarasa and 1 part of Eshti Churna. Eshti is the Kalka and Swarasa is Kushmanda Swarasa. Very effective in managing Paitika Abasmara. Then Karaskara Krida, which is told in Vadashonita Adhikarana, is also having very nice effect in managing the epileptogenic factor of this Paitika Abasmara. And then Tiktaga Krida is also widely used. Then coming to Panchakarma procedures in managing seizures, Murtha Daila is widely used because the Rogadhisthana is Shiras and Shiro Abhyanga, Shira Seka and Shiro Vasti is used only in elder children. Shiro Abhyanga and Shiro Dhara is widely used. Dashapushpadi Keram is a wonderful drug for managing Vada Kapaja seizures. Vachalashanadi, Tripaladi, Nirkuntyadi, etc. and managing the Kaba dominant type, and Vada dominant type is managed very nicely with Dhanvantara, Mahamarsha and all. While coming to Vada Paitika seizures, Balahada Adhikera is very effective in managing Vada Paitika type, while Bela is addressing the Vada dominance and Ramacha or Ushira is addressing the Pitta dominance. Shirabala, so as you all know, is effective in managing Vada Paitika type. Vadashini, Chandana Dikera, Mahanarayana Thailam, etc. comes under that category. Nasyam is very nice in managing the seizure because it's Urthwanga and Nasa hi Shiraswadara, Varanadi Kshirakruda, that is drugs of Varanadi, and Shirakruda from that is taken in managing Vata Kapacha types. And especially in Kapacha dominant seizure, we used to do Mana Nasya also, that is Churna Nasya. While in Pitta dominant, Shirabala, Avartida Taila, and Shira Guluchi is widely used. Shiro Ubanaha, that is which I'll elaborate later. Shiro Ubanaha is widely done in Vata Kapha dominant type, and Shiro Lebam, that is Pitta Shamana variant, which I will elaborate later. Talam, again a Kerala traditional way of managing seizure. This Bala Musta Rasna Devadaru is a drug combo which is specified in Arogya Kalpatruma, is very effective in managing seizure. It can be baby friendly. I have head application of this external application of medicated paste with 4 drugs: Bala, Musta, Rasna, and Devadaru. It's powdered into fine powder, and an emulsion is made by mixing with Eranda-Taila, Stanya, and Sahadevi Swaras. That emulsification is mandatory to get that absorption of this Bala, Musta, Rasna, and Devadaru. It's a typical combo that micro emulsifiers are carried out to the brain for controlling the seizures. Bala, Musta, Rasna, Devadaru, fine powder mixed with Eranda-Taila, Stanya, and Sahadevi Swarasa. And another option is Shikra Swarasa and Rasnadi. Then Karpuravalli Swarasa and Krishnadi Kuliga is also used. While in Paitiga dominant conditions, butter is the main medium of Tala. Kachuradi Churna and butter usually used. Panchagandha Churna is also readily available in market. It can be used with ghee and stanya and used for Tala. Amalaki Churna, dried amalaki powder in Brahmi Swarasa is also effective in managing Paitiga dominant seizures. Mustadi Raji Abanavasti is more effective in Pitta dominant seizures, while Kapha dominant seizures are managed very nicely with Divacha Muladi Kashayavasti. Can use Kalavasti, Yogavasti, or Kalavasti according to the gravity of the situation. Vacha, Takara, and Taila are used as Rasayana drug usually in Kapha dominant types, while Eshti Shankamushpi in the Pitta dominant types. There's the snaps of Shiropiju going on. Shirodhara, Tailatara going on. Now, I think all other procedures you are familiar with. I need to describe only the Shiro Leba and Shiro Upanaha procedure. Shiro Leba is actually, even though both are Leba or application of medicated paste of the scalp, Shiro Leba is usually having a more classical description, even in Kerala traditional Balachikilsa texts and all. Unmada and Abasmara Adhikarana is narrating many types of Shiro Leba. Bela Sohaladi is one type of Shiro Leba which is narrated in Arogya Kalpatruma text. It is a medicated paste of Pitta Shamana, drugs having Vada Pitta Shamana properties. That is, it's made into medicated paste and usually mixed with milk or butter and externally applied on the scalp. The duration can be like depending upon the condition of the patient. It can be increased like even up to 8 or 9 hours you can increase. Like in classical description of Bela Sohaladi Shiro Leba, which is told in Arogya Kalpatruma, it's like overnight application of this Shiro Leba on this scalp also. We can do also like that. Clinically, we had tried that Shiro Leba a lot, and clinical results are promising in that case. That is, Shiro Leba is usually we call for like Pitta Shamana drugs are applied on the scalp. Shiro Upanaha is another situation. When the Rogadhisthana is Shiras and the involved dosha is having a dominance of Vada and Kapha, we need to give, even though Shiras is an Asvidhyanga, we need to give Svedana or Kapha Vilayana in the Shiras. So, considering all that Asvedana precautions, contraindications for Svedana in the Shiras, we plan to do a Svedana in the Shiras because the gravity of the disease is that much. So, Shiro Upanaha is Svedana with a medicated paste. The Upanaho Vajakinno Sadahua Devadaravihi Thane Samaste Sakende Ischa Rasne Eranda Jadamishe. From that enlisting drugs, we select Methya, Tichna, and Ushna drugs. powder it, make into a fine powder, mix it with amla dravyas, like usually we mix it with takra. Musta takra is widely used. Mix it with takra and make sure that takra is having more amlatva guna to ensure that Ushna Bhava and Vyavayi guna of that amlatva is of takra is more. Ensure that takra is much more amla when we are doing Shiropanaha, and keep it that thick medicated paste is pasted on the scalp and it kept for a duration of more than half an hour. This Shirolepa going on, where in Shirolepa we cover the leba with Pitta Shamana patras like lotus leaf and all, while in Shirupanaha, this is Shirupanaha going on. Cover similarly, the drug actually differs. In Shiroleba, Pitta Shamana drugs are used, and Shirobanaha, Tikshna, Svedana drugs are used. Cover it with air and the patra. This is Nasya going on. Usually, Pratimascha Nasya is used in kids as the age permits only that much. And you should consider the efficacy of Snehana in managing this epileptogenic focus, because ketogenic low carb, low protein diet is very effective and is very effective in managing that epileptogenic focus. As I think when I searched for that literature, almost 700 peer-reviewed publications were there, citing that efficacy of this ketogenic low carb, low protein diet. This is what we follow in Acha Snehapana. That is almost 4:1 ratio, 4 parts fat and 1 part carbohydrate. That is in Achavana also we allow more than almost the entire day, almost 3/4 of the day we are having only the fat diet to the baby. We give a quantity, like a big quantity of ghee in the morning, and just we allow a little bit of rice soup in the evening, or mudgarasa accompanied with that. That is little bit protein and carbohydrate. That is ketogenic. It is similar to our Acha Snehapana. And this is that this is a study which was I was talking about. That is, we had a clinical study in the department. That is, we came to know that our patient approaching us with intractable epilepsy was very much. A huge number of patients were approaching us for the management of intractable epilepsy. Intractable epilepsy means the patient will be on more than 2 or 3 anti-epileptic drugs. And even with that multiple anti-epileptic drugs, the patient will be, or the baby will be having clinical seizure more than 4 to 5 times a month. That is what's called intractable epilepsy. Usually Sannipatika type of seizure. So we are not supposed to withdraw the anti-epileptic drugs. So our drug was kept as an add-on to the anti-epileptic drug. So clinical study was conducted to evaluate the efficacy of Vilya Panchanga Krida. That is Panchagavya Krida processed in Vilya Panchanga. Krida was introducing the severity and frequency of intractable epilepsy in children under the age group 2 to 12 years. Therapeutic intervention pre-post trial. Study setting at Government Ayurveda College Trivandrum. That is 2-month intervention period and with a 2-month follow-up as well. And inclusion criteria was children with uncontrolled epilepsy of age 2 to 12 years were taken, who had more than 5 episodes per month, even in spite of that anti-epileptic drugs. Exclusion criteria was the status epilepticus was excluded, and baby having severe respiratory infection, which prevents the baby to have that Snehapana was also excluded. This was a study of Dr. Deepa Ravindranath and one of very nice student of our institution. And outcome measures was measured through Haig seizure severity scale, a standardized seizure scale for assessing the seizure severity, and the frequency of seizure attack was also elaborated. This is the study result. Before and after assessment, we know that the mean score was 32.5 in before treatment, and after treatment it came like 43. The more the score, the less the severity of the seizure is. 43. And again, it's very nice to note that even with the withdrawal of a drug, there was no increase in seizure severity. That is, our drug is not having any withdrawal result. That's also a wonderful wonderful observation from this study, that the p-value was very 0.001. The seizure severity was increase in seizure. Haig score means decrease in seizure severity. And that's the clinical part of that. I think my time is over, and I invite all the interactions and during the section. Any doubts, anything from your side, I am happy to clear it. Thank you. Thank you one and all for the patient hearing.
Thank you, ma'am. Actually, your lecture was very excellent. How seizure occur, its types, and clinical picture with nice video. You have explained it, and also you have focused why there is a need to start Ayurveda treatment in details with various formulation of Ayurveda. Along with Panchakarma, you have explained, as all of we know that there is a popularity of Kerala Panchakarma in India as well as globally. Basically, I am also from Balrog, so any child can have seizure under any circumstances. It may be due to fever, high-grade fever, lack of oxygen. Sometimes it may be due to head trauma or any other illness could bring a seizure. And at that time, patient are diagnosed with epilepsy when they have seizure that occur one or more than once without any such specific causes. So this is there is anxiety among the parents about their child health condition. So in this condition, there is also need to aware the parents about what to do or not to do in that epileptic attack of our child. So it is also part, if any research can be happen with the development of various awareness program about this disorder. So very nice explanation, Dr. Roshni ma'am. I would like to now introduce the moderator for this session, Dr. Archana Bhadna. She is currently working in the Department of Biology at the Government Ayurvedic College, Nagpur. She has guided many postgraduate students, has published many research paper articles in national as well as the international journals. So I welcome Dr. Archana ma'am to moderate these sessions. So over to you, Dr. Archana ma'am. Please, welcome you. Hello, Dr. Archana ma'am.
I think she is
unmute.
mute.
Please unmute. Please unmute yourself, ma'am. There is a button in left side. On mic, you have to click, ma'am.
Needed. Permission is okay. Thank you.
Yes, ma'am. Yes. Okay.
Am I audible now?
Yes, ma'am.
Good afternoon,
Namaste,
everybody. Namaste. Good afternoon, everybody. All respected faculty members and my dear colleagues. I'm very much thankful for the organizers of this national webinar on Kaumar Nritya for giving me the opportunity to share my thoughts, and as a chairperson or moderator for the session conducted by our dynamic, eminent, knowledgeable speaker, Dr. Roshni Aniruddhan madam. We all had listened to the lecture given by Dr. Roshni madam on childhood epileptic disorders, its management through Ayurveda. It was very nice lecture given by madam. As we all know that the epileptic disorders are very common in children. Madam has very well explained how to differentiate seizures from the epileptic seizures, because many times patient comes with convulsive disorder in our OPD and we get confused whether it is epilepsy or simple convulsions, maybe febrile convulsions or anything, any other type. But madam has explained it very nicely and mainly focused on the how to deal with the febrile seizures. Thank you, madam. Again, we all know to differentiate the various types of seizures is a very difficult task for a physician. Again, with the help of videos which madam had shown, I think all the participants must be very clear now to differentiate various types of seizures, especially atonic, myoclonic, tonic seizures. And definitely madam's lecture had helped a lot for easy diagnosing the epileptic seizures. I think a very nice and informative lecture given by madam. Not only this, but madam has given the Ayurvedic classification of epilepsy, apasmar, what we say. And according to the different doshas of involved in the disease, how to treat those patients with different panchakarma or supportive therapies. That has been very well explained, Dr. Roshni madam. We also do the panchakarma therapies in our institute for the
Madam, you are not audible, ma'am.
Now it is audible.
Yeah, now clear.
Yes.
Yeah. So how to treat epilepsy patient, especially the interactive epilepsy, madam said we have to continue the medicines which are anti-epileptic drugs which are patient is taking, and along with that we should add our Ayurvedic medicines so that the frequency of epilepsy can be controlled. And we all know that anti-epileptic drugs are producing some hepatotoxic effects, so that these drugs are having many side effects. So along with these anti-epileptic drugs, if we add on our Ayurvedic treatment, definitely it is going to help the patient more, and the prognosis of the disease will be really admirable. So I am concluding here by giving my special thanks to Principal Jupiter Ayurveda Medical College, Dr. Subhash Wage sir, for giving me this opportunity, and the whole organizing team, Dr. Danga sir, Dr. Deshmukh sir, Dr. Shrikant Hadole sir, and Dr. Lade sir, for giving me this opportunity as a moderator. Thank you, sir. Thank you very much.
Thank you, Dr. Archana, for your valuable time to moderate these sessions. Actually, I am familiar with you. I think you might know me.
Yeah. You are my student, I know.
Yes. Thank you. Really, thank you. And I would like to thank you, our principal, sir, Dr. Wage, sir, only because of him, today it is possible to have such eminent expert on Kumar Bhattya. In the first session, Dr. Swami, sir, was there, and now Dr. Roshni. It was very, very scientific and very interesting also because of the video that ma'am has taken with their effort. So I would like to appreciate also for collecting the videos, the moment they have taken, the moment they have captured the various seizure attack. So it was very explanatory. So thank you, Dr. Roshni ma'am, and Dr. Wage sir, for giving me opportunity to introduce both the eminent expert as well as the moderator for today's webinar. So thank you, Dr. Archana ma'am also. And now over to Dr. Shrikant sir for next proceeding.
Thank you very much, Sundar sir. It was really a very nice session, madam. I was watching all the videos very vigilantly. It was really very nice to see each and every detail about the seizures and all the clinical aspects that we usually read through our textbooks. Thank you very much for such a very nice presentation. And I'm thankful to our respected principal, sir, for organizing this event and for inviting such eminent guest speakers. Thank you. Now, before proceeding towards the last part of this session, I have an announcement for dear participants that I have shared the feedback form link in the chat section. I request all the participants to please submit their valuable feedback. Once you submit your feedback, you will get a link to download your certificate. So please proceed with the feedback form. Thank you. Now, I would like to request our respected principal, Dr. Subhash Wage sir, for vote of thanks. Over to you, Dr. Subhash Wage sir.
Shrikant sir, we are heading towards the end of the webinar program and webinar series also. First, before I finally give a vote of thanks, I want to congratulate Dr. Roshni Anirudhan Madam. And everybody is so much happy and everybody wants to express their feelings about your lecture. I'm seeing the enthusiasm and word of, I'm seeing they are very, enthusiastic to have to say something about your lecture. I can see on their face and I can see from their reactions. Before I give a vote of thanks, there is one question, and this is to Roshni Anirudhan Madam, whether we can manage seizure disorders completely with the Ayurvedic treatment.
Shall I answer, sir?
Yeah.
Actually, it's unethical to withdraw the modern management and start our management. So I don't have experience in withdrawing the anti-epileptic drugs and managing without treatment alone. So I usually add on our medication along with that ongoing anti-epileptics. And as an add-on therapy, it is very effective in managing the seizure condition, because baby will be on seizure medication maybe for last 3 years or 4 years, and the seizure will be going on increasing. Severity will be usually going on increasing. And when we add on our medication and Panchakarma treatment along with that, for a period of time, it will be entering a plateau phase. Like plateau means the severity won't be increasing for much more later. And slowly after a period of 1.5 or 2 months, slowly that seizure severity and frequency, both severity and frequency will be slowing down. The duration of seizure will be coming down, that frothing, everything will be coming down, the respiratory arrest, then associated complaints will be coming down, and the frequency, it will be coming down like 5 to 10 months of a month, like 2 times a month or so. And the neurological, moreover that the neurological status will be improving. So that baby will be improving the cognitive, social abilities, and development quotient will be improving. Apart from that, it's not only seizure control, but what we aim at. It's the epileptogenic focus management we aim at. So overall, with a period of like 6 months or so, along with that anti-epileptic drug, we are able to manage the seizure very well. And so after that period of 6 months, we again direct that patient to that allopathic or modern neurologist, so that she or he will be able to taper their anti-epileptics with their rapport with us. So they won't be having a grudge with that Ayurvedic medicine also. So they will be tapering their medicine. Again, we will be continuing our medicine, and slowly they can withdraw the full modern anti-epileptics, and we can taper, we can go on to Rasayana therapy and end the treatment and leave the baby seizure free. That's how we plan such. I think I'm clear, sir.
Thank you, madam. Usually, the neurologists, they prefer to give it for almost 3 years continuously.
Yeah.
And in most of the cases, we have seen that they, with continuous treatment for 3 years, they taper or completely stop the anti-epileptic treatment, and patient is devoid of seizures then, and lives a happy life. In your observation, have you seen any time at any point that you started Ayurvedic treatment, and with the patient was getting episode twice a month, and with the intervention of the Ayurvedic treatment, the seizure attacks were prolonged to some once in 3 months or once in 4 months, or likewise the frequency of seizures has came down?
Sure, sir. In more than 95% of our cases, seizure severity and frequency will be coming down with our medication. Only thing that rest 5 of the cases, it may be severe form of epileptic encephalopathies, or our dosa judgment was not correct. On all other cases, more than 95 of cases, we have success rates, sir. Seizure severity and frequency will be coming down. If the baby is having prior 5 seizure per month, after our medication, like it will be next month, it will be like 3 or 4 seizure per month. And after a 2-month, baby will be having at least like maybe she is having 1 seizure in a month or so. It will be coming down soon.
Okay, thank you, madam. My mentor, Dr. T.Y. Swami is here. Sir, would you like to add from your side on the, would you like to share your experiences regarding seizure disorder and Ayurvedic management?
Yeah, last 2 years we are rigorously working on the topic, especially these conversions. What madam said is very right, that we can't go for an withholding of modern antiepileptics. We give our antiepileptics irrespective of the cause. We are doing that, and we are doing this for last 2 years, and we are estimating the serum levels of the this antiepileptic drugs. Even the drugs, by adding us, the serum levels and toxicity of the phenobarbital like drugs has been reduced. That's what we are observing. So this is our 3rd year within a documentation we are trying this year. So definitely antiepileptic is one of the important area. Now we find out. After the antibiotics, this is one of the good area to develop Ayurvedic drugs. Because the modern people use all the available antiepileptics. Still the epilepsy could not be controlled satisfactorily. Hence, we introduced this again with some Rasophilans. We are doing it. And what madam said is right. So the frequency as well as the duration of the epilepsy can be reduced. But there is a lot to do. Many things have been done, and still we have to do a lot of work to give a concluding report. Thank you. Am I clear?
Thank you very much, sir, for your valuable inputs. We are really blessed. During our time also in OPD, we used to see this seizure disorder, and that time we used to manage it with the sodium valproate and other Saraswat Purna, etc. But that long time management or long time follow, we could not keep it. So that was the lacuna that time. The period of registrarship was very short tenure of 2 years, and long time I could not keep the long time record with that. Remember those days.
Okay, thank you. Thank you very much. Thank you for your effort.
Once again, I thank Dr. Swami sir for introducing me to this group, which I was not so familiar with, and I hope we had a nice time together, sir.
I'm really thankful to Swami sir for adding one more friend to our list. And now, formally, I will give a vote of thanks. I will start with the recognition of our webinar from Maharashtra Council of Indian Medicine. I thank Dr. Ashutosh Gupta and Secretary Dr. Wange for taking efforts and giving us their recognition within a time. I thank heart, and I thank the university officials, particularly the faculty dean of Ayurveda, Dr. Shrikant Deshmukh sir, Dr. Phugare, the registrar, Dr. Kalidas Chavan, the registrar of MUHS, and the Ubade sir for giving us their recognition in time and endorsing our webinar from university side. I also thank the MUHS Observer for sparing time with us and observing this entire event of 6 webinars. And I thank our secretary of our college, Dr. Mrs. Tarini Nikhare, madam, for continuously encouraging us to carry out such type of activities. She is our backbone, and she is continuously motivating us and supporting us to undertake these type of events. I'm really thankful to her. First guest speaker, Dr. T.Y. Swami sir, who is also my guru and mentor. Thank you very much, sir. Although he earlier he said that Subhash, I usually don't come on, don't share my platform with anyone. I don't give any guest talks. I'm so much busy. He's really busy. He's carrying out many activities. But for you, but as you said, I cannot deny also. So I will definitely come. But you keep it as not only, but see the greatness of a man, that he don't want to share the entire credit with him. He asked me to keep the heading in Flair as it is the team pediatrics, which is team pediatrics, Government Ayurvedic College, Usmanabad, which is presenting the presentation. So I thank Dr. T.Y. Swami sir and his entire team, Pooja Raut madam and others involved in the presentation. And the moderator, Dr. Nitin Wagmare sir, who at a very short notice agreed to moderate the session from Hadapsar College. Then my sincere and very special thanks to Roshni Anirudhan madam. Really, I have no words to laud your efforts in this regard, collecting the videos and taking pain to share for experimenting with the Ayurvedic medicines and sharing your valuable experience with us. And we are really blessed with that knowledge, and hopefully the coming the budding generation of the pediatricians will be greatly inspired with this, and they will carry out it, take it further, and will carry out the experiments with the Ayurvedic anticonvulsants, and they will try to evolve a therapy which will so that the entire management of the epilepsy could be done, could be possible with the Ayurvedic drugs only. I think CCRS is doing a lot of research work in this direction, and they have developed a drug for Apasmara also. So what are its results? Everyone has to carry out the trials in their centers and assess for its efficacy. So thank you once again, Madam Roshni Anirudhan Madam. With just our small request, you agreed to deliver, and with the help of Dr. Swami sir, I was able to contact you, and and you have delivered such a nice lecture that everybody is pleased with your lecture, and everybody is motivated, everybody is inspired. Thank you very much, Madam. And I thank my senior, Dr. Archana Bhad Madam, who is the pediatrician at Government Ayurvedic College, Nagpur. She had also agreed to moderate the session at very short notice, and I can, as she being my senior, and I can ask her at any time, and she readily accepted our request. I thank you, Madam Archana Bhad Madam. Thank you. And lastly, from the I thank the MUHS observer, Dr. Agrawal sir, who is also our senior, and the board of study member from Maharashtra University of Health Sciences, Nashik, and the observer for all webinars. And I thank my right and left hands, without whose cooperation this entire exercise of 6 webinars would not have been possible. The Dr. Shrikant Hadore sir, who had provided all the technical expertise in smooth conduction of the, not only in the smooth conduction of the webinar, but the timely delivery of all the certificates to guest speakers and the participants. And probably we are the first college in India who are giving the certificates then and then only. He had given talks at many places, but still I could not get that certificate of appreciation. But we are giving then and then only to everyone, each one of them, and this is only possible because of the efforts of the extraordinary efforts of our team member, Dr. Shrikant Hadore sir, who is not only technically expert, but is very truly a very beautiful and excellent academician also, and a great botanist also. He is a lecturer in Dravya Guna, is having expertise and cultivation of the many drugs and entire thing of the Dravya Guna. So I thank you, sir. Shrikant sir, are you there?
Yes, sir. Thank you very much for your words.
Thank you very much. Actually, I have no words to express my thankfulness to you. And similarly, I extend my words of thanks to my younger brother, Dr. Sundar Singh Danga, who is constantly with me, and he carries out whatever I say. These all to the young, my younger brothers. They take it and execute the things so nicely and so properly and so perfectly that they leave no stone for any complaint or anything. And I am very proud of both of them. I'm thankful to Dr. Sundar Singh, sir. Thank you very much, Dr. Sundar.
Thank you, sir. Thank you, sir. Thank you for
You are
the
not
kind
only
words.
you are not only carrying out the things here which I tell, but Dr. Sundar runs Ayurved Career Research Academy, and through this academy, he is doing a great job of orienting the budding MD, MS, and PhD scholars, and orienting them in a research direction. He's every monthly or twice bi-monthly, he conducts reorientation classes for them, and he's famous for that in all over India now. A renowned figure, and he's very sound in research methodology techniques. He teaches apart from Balroga, he teaches the research methodology techniques also, and he is a vice principal of our college also, and he's engaged in NAC activities, NABH activities, and so many things he's looking after. I'm proud of you, Dr. Sundar, and thank you for nicely executing the things. Lastly, I would also like to thank all my colleagues at Jupiter Ayurved Medical College and Tarini Hospital, Nagpur, for their constant support throughout the webinar series and their active involvement at various stages of this webinar, because conducting such huge webinars is not a single man's job, and they all cooperated me at various levels of this program. So I thank all of them, and I thank all of the participants also who keenly observed our programs and who actively participated in our programs, and with their overwhelming reactions from the feedbacks what we are getting. They already conveyed us that they are immensely benefited from all of our this webinar exercise, and they want more and more such things from us. So I want to assure them from my side that this is not the, though we are ending the webinar series here, but it's not the end of the academic fees. We from time to time we will again conduct such programs, practical oriented programs. Now the turn of Kaichikitsa department, Panchakarma department, they are also left. We will come with some other very interesting topics, and we will continue our job to create inspiration and motivation for our budding physicians and surgeons. So I thank one and all. If I'm forgetting anyone to quote, I beg pardon. I'm thankful to everyone, and with this we are concluding our session and our webinar series here. We will meet again. Thank you. Bye bye. Thank you very much.
Thank you, sir. Thank you. Thank you all. Very nice.
Thank you very much, respected Dr. Subhash Wage, sir, for your kind words. Just because of you, we could arrange this beautiful webinar series on practical aspects. Thank you very much for always motivating us and keeping us energized in organizing such events. Thank you very much. So we conclude this session here.
God bless.
So we conclude this session here. Thank you.
Yes, yes.